Hydrocephalus is the buildup of too much fluid in the brain. Normally this fluid cushions the inside of your head, but when you have too much, it puts harmful pressure on your brain. Hydrocephalus can be present at birth or develop after birth. When present at birth, its causes include genetic problems and issues with how the fetus develops. The main sign of hydrocephalus is having an abnormally large head. Acquired hydrocephalus can occur at any age. Symptoms of hydrocephalus are headache, vomiting, blurry vision, balance problems, bladder control problems, thinking, and memory loss. Causes of acquired hydrocephalus are head injuries, strokes, infections, tumors, and/or bleeding of the brain. Hydrocephalus can permanently damage the brain, which can lead to problems with physical and mental development. If untreated, it is usually fatal. Treatment involves surgery where a shunt or flexible plastic tube is inserted. The shunt moves the fluid to another part of the body where it can be absorbed. Hydrocephalus is diagnosed through clinical neurological evaluation by using cranial imaging techniques such as CAT scans, MRIs, or pressure monitoring techniques. A physician selects the appropriate diagnostic tool based on an individual's age, clinical presentation, and the presence of known or suspected abnormalities in the brain or spinal cord. A limited number of individuals can be treated with an alternative procedure that is not recommended and extremely expensive. In this procedure, a small camera that uses fiber optic technology to visualize small and difficult to reach surgical areas allows the doctor to view the ventricular surface. Once a scope is guided into position, a small tool makes a tiny hole in the floor of the third ventricle.
A CSF shunt involves insertion of a valve that regulates and drains the excess cerebral fluid from a patient's brain. The operation normally takes less than an hour, and it is a common procedure done by skilled neurosurgeons. Incisions are made to the head and abdomen. Tubes are then passed through the fatty tissue under the skin. A small hole is made in the skull to allow the ventricular tube to be passed into the lateral ventricle. The peritoneal tube is then placed into the abdomen to allow the fluid to drain. After surgery, the patient will typically spend up to 7 days in hospital to ensure the procedure has been successful. A far more effective solution exists in the form of an adjustable valve. This shunt is identical in every respect to the fixed valve, but critically allows the physician to make small adjustments to the pressure setting by using a remote magnetic programmer, eliminating the need for further invasive surgery and ensuring the best possible improvement for the patient.